My name is Brenda. I am an owner and operator of an online radio station, but I'm also a very avid mental health advocate.
Hi, my name is Wairimu. I am a member of Wairema Foundation Trust. We started the Wairema Foundation Trust in 2015 and have been working to create awareness about mental illness, specifically depression, because Wairema suffered through depression, and we just wanted to let people know that it exists for one, and there's a lot of stigma about it, so try to just demystify the whole what depression is and how people can seek help about it.
My name is Tari Malingat, and I am currently a pre-KSL student. I am very interested in mental health because it's something that's hit close to home, and it's just something that I feel has been neglected in Kenya particularly.
My interest in this lies because I enjoy mental illness, and I like to say that because it's 50-50 on any given day, and that's better than a mundane life.
In the recent past, I've seen a lot of people lose their lives because they suffered alone. Many people have committed suicide or are going through things which they're not able to share, especially coming from strict African backgrounds. And I've seen a lot of people decide that suicide was the best option. Some of these people have been my personal friends and family members, and I feel like it's time that we got to the bottom of some of the things which are affecting young people in Kenya, and it's time to debunk some of these myths so that people can know that it's okay to seek help.
Everybody has a thing going. It's only that you cannot tell what's going. And many people think that if you are rich, you cannot get depression. If you are poor, maybe you cannot get depression. But I want to tell you, depression is for real, and it's here to kill many of us if we don't take care of it.
First one, probably the biggest one, is that you can put in a lot of work and it goes away. This isn't true for every illness, but for most of them, this is like a lifelong thing, right? So you live with it every single day, you just learn to cope with it. There's no amount of medication or yoga or, vacations or therapy that's just gonna reset your whole life, right? So it's something that somebody carries with them throughout their life. And if it doesn't look like they're struggling, it's just because they've gotten really good at managing it.
Crazy, unstable, unpredictable, psycho, and we say these things so easily, but you will not call a cancer patient crazy or unstable. You will not call a diabetic patient crazy or unstable or just faking it.
People associating mental illness with a character flaw, that, oh, then she's weak or she's lazy. People with mental illness are weak. That they don't try hard enough, and that's a big problem because we are trying. They are trying. Like, mental illness you are not your mental illness. It is just a part of you. So when people associate your character with a mental illness, it's very unfair because it's something that's happening to you, not who you are.
Mental disorders are genetic in nature. Now, this isn't necessarily true. While some mental disorders can be genetic, or genetics can play a big role in that, there are other triggers to some of these afflictions that you go through. These can include trauma, this can be a hormonal imbalance, and other psychosocial factors. Of late, I feel as though social media is a big contributor to this because it brings about an anxiety which, if not dealt with, can lead to a much more serious psychological disorder.
Depression does not come as a curse. So when you see me doing a certain thing, don't say that I'm cursed or my family is going through this because of a curse left. No. It's a thing that starts from the brain down to your heart because it hurts here. And what people don't know is you can't pinpoint exactly what you're feeling. I can't tell you the feeling that I'm going through. But as I explained to youth, because I'm working with youth right now, depression is kind of like something, you have your first boyfriend-girlfriend thing, and the boyfriend dumps you. What do you feel? Pain. And the pain is not here because you might take Panadols and whatever. It doesn't go. It's here. I think that when you feel you're helpless, hopeless, you can't wake up in the morning, you don't want to do a thing, you just want to sit in a corner, cry, hide, shut yourself out from everybody else. Then before you know, you're not taking care of your health, you're not eating, you lose interest in things. And yeah, in short, that's what depression is all about.
I want to touch on something that's a little bit macabre, and that's suicide, right? A lot of people think that suicide is a very selfish act, and they're always talking about, they leave behind broken families and people in pain and all that kind of stuff. But a lot of the time, suicide is actually the most selfless thing a person is attempting to do. You're trying to remove yourself from everybody else because depending on your affliction, you feel like you're a burden to people. And that doesn't make you feel any better. When people share you and, they're all walking on their toes around you and then they're being like hypersensitive. And that's kind of what you don't want, even though you appreciate the fact that they acknowledge that you're a little bit, different. So suicide is a way out for people who are trying to escape pain, but it's sometimes a way for people to try and alleviate whatever perceived pain they're inflicting on others.
You're supposed to look a certain way. Oh, you don't look like you have a mental illness. You seem happy. You seem fine. I mean, you're going out every night. You're happy. Your Instagram, your Facebook, it looks like you're having a good time. But really, you're not. Really, you're suffering inside. Mental illness does not have a look. People suffering mental illness are very good at hiding it because they're alone. They don't know who to talk to, who to turn to. But a lot of people are suffering. So when you see someone and you notice a few things here and there, take note. Because people are hiding them very well. So go out and talk to someone. Try and find out how they're feeling, how they're really feeling. Ask them how they are. Not that, how are you, that people say every day on the street and don't really care about your response. Really, truly mean it. Have a one-to-one and find out how they're really going. Why are they, doing the things they're doing? Because some people are just acting out or doing these things because they don't have anywhere else to go, anything else to do. So I definitely think it's not a certain look. You shouldn't be looking for a look. You should be looking for certain signs that would worry, that don't seem normal, that should worry you, or that are not like that person.
The other thing would be that, it's just a phase. They're just being a rebel and they're just being difficult. And that is the word we as youth hear, especially from our parents or, the older generation. They just think we're acting out.
The notion that you can decide not to be affected by a mental illness, okay? Now this is 100% not true because mental illness varies in its intensity and its symptoms. So you have things like sexual disorders, psychosocial disorders, sleep-eat disorders, schizophrenia spectrum disorders, depression, and other afflictions which you may not necessarily have control over. So it's not right for you to assume that people who are suffering from mental illness have a choice in the matter. It's never a choice.
People are so quick to judge and they don't want to understand it, and it's high time somebody actually just tries to listen to what we're trying to say, and that's why we're here having this forum, and I hope that you're listening.
A lot of people say that you shouldn't take medicine to cope with the effects of mental illness. Now this isn't necessarily true. It all depends on what your medical health practitioner recommends. A lot of times we use something called cognitive behavioral therapy to help you deal with the effects of mental illness. However, sometimes in extreme cases, they may recommend that you supplement that with a certain drug under prescription. Now, whereas it may not be sustainable to stay on drugs which have very many negative side effects, it's also not okay to misadvise anyone who's going through mental illness that they should avoid drugs completely. The Arena Kenya is going to have a couple of blogs up on how you can help identify and treat your friends and loved ones with mental disorders. Follow us on all our social media platforms at The Arena Kenya, and please subscribe to the channel so that you can keep up with this YouTube series on Beyond Awareness, a discussion on mental health.